I'm an interventional cardiologist, but I've taken a specialty within that, which is structural heart disease. We do minimally invasive valve procedures without needing open heart surgery. I can offer them therapies that didn't exist 10 years ago. So when I was a medical student here at Yale, we had a patient who was turned down for surgery because they felt like she was too high risk for an aortic valve surgery. And now, about 10 years later, that's my whole career, is doing valve replacements through catheters. Really the most rewarding thing when I see a patient is to say, yes, I can help you. One of the major diseases that I treat is emergency heart attacks. One of the really concerning things is how often people ignore symptoms of a heart attack. I always encourage patients to pay attention to symptoms that they're having. They can be nonspecific symptoms: pressure in the chest, tightness when people are trying to breathe, sweating, pain in the arm or the neck. Those are symptoms that could be a heart attack. And I always urge patients that if they're having symptoms that they've never had before, that are hard to place, that they should seek medical attention for those things.